Dr. Blake Pearson, you're no stranger to Business of Cannabis. We look forward to connecting with you today. Thanks for being here on a Monday morning.
Thanks for having me on again, Jay.
We've talked a lot about in the past how you train other doctors to incorporate medical cannabis into their regimes. You've talked about how patients are using it, how we talked to you a lot about medical cannabis. Last week, I saw you posted something around getting more people covered by their insurance for cannabis. Talk a little bit about what Cover Cannabis is.
Okay, so we launched Cover Cannabis as the pandemic kind of went on. It became kind of clear to me that we need to speak up about this, because I'd been seeing patients of mine just gradually, as things went on with COVID, coming off their cannabinoid medicine due to cost. So it was kind of like, for me, just a period of seeing this daily and hearing these stories of, enough's enough. Something has to change. So I'm going to try and do my part to raise as much awareness around this issue, highlight as many cases as we can, patient cases, testimonials, to make this picture very clear, because it's disheartening for me, because patients will be crying because they can't afford their cannabis, and it's just getting worse and worse. And in a country with, legalized socialized medicine, it's absurd, especially when, so the flip side to this is when things like the things we're trying to take them off of, like their opiates, right, in chronic pain patients, or their antipsychotics in the dementia patients, are actually covered. So to me, there's a number of reasonable arguments to make why this needs to happen, and I just want to get the word out there.
And we want to help. And one of the ways we do it every year is through Medical Cannabis Week. But specific to this, and this came up Medical Cannabis Week in November, which was, patients really not being able to afford what they need, yet also understanding this is a better medicine for them than what they were on before, not only from an efficacy perspective, but just from an overall health perspective.
Yeah. So it's a fairly simple thing to comprehend. It's just, I think when people hear the word medical cannabis or cannabinoid medicine, their stigma or their bias will turn off their listening, right? And they won't even listen to that logical argument, because again, you're bang on, Jay. It is, when you talk about opiates, yes, cannabinoids have evidence for chronic pain. Yes, they are less harmful than opiates. If anybody would like to debate that, then we can have that conversation, but I don't think anybody really does anymore. There's no lethal dose, right? We don't have people injecting their cannabis and overdosing. So from a harm reduction standpoint, it's better. From just a tolerability and side effects, really cannabinoid medicines are generally well tolerated. And then when you flip the script again to our long-term care residents, and again, why Cover Cannabis and the movement is going on, is because a lot of these families who are choosing cannabinoid-based medicine over more harmful antipsychotics for their loved ones, same story. Maybe their loved one who's paying for the medication for the dementia got laid off or furloughed, and now they're going back to these more harmful medications, when straight up head to head, even with the antipsychotics, cannabinoids are generally much safer and better tolerated.
Well, you also, I would say, a lot of people are using the Bernie Sanders meme over the past couple of weeks, including us. We put him in the little box, actually, which you'll be in for this interview. But you used it because he tweeted, I don't even know. I mean, it could have been any day over the past 30 years of his life if Twitter was around. But banging on, people can't afford their medicine. Let's get people covered for medicine. He was talking about the crappy healthcare system in the US, but it also applies here to what we have as a fairly robust medical system. And it's, it's worlds ahead of where the US is, but it really is, how do we get the medicine that's helping people covered by insurance?
Yeah. And so that was just perfect timing with that, the Bernie Sanders meme and the movement. Shout out to my team for tying that together. But it's one of these things where I think, we can raise the awareness, which is what we are going to do. It's what I'm passionate about for this year and likely my whole life, until this actually gets covered. When when it talk to the practical aspects of it, you know, I think insurance, government are going to say, well, we can't have everybody just on medical cannabis, but that's not what's going to happen. There's, in my mind, some illogical steps with vulnerable populations, dementia patients, the kiddos with the rare seizure disorders or severe autism, patients who are on opiates, who have a plan to come off of them using cannabinoid medicine. I think there should be a just basically like a schedule or some type of waiver that the physicians can fill out, or a special access scheme you fill out for these accepted diagnoses, and we at least get the ball rolling for the vulnerable populations, and then we can move from there.
Well, I want to help spread this word. We're going to put people in touch with you as this goes out. We'll continue to link to you and how to get in touch with you. But I also want to thank you for your leadership working with patients, your leadership as a physician, working with other physicians, your leadership on causes that are important to patients and really the movement overall. So thank you, Blake Pearson, for being with us on Monday morning, kicking the week off on an important note as we head into full-fledged 2021, things that people can actually do to make life better for a lot of patients. And so thank you for being here today.
Awesome. Thanks, Jay, for all the support.
You got it.